Kenya is targeting the vaccination of at least 10 million citizens by the end of this year in its revised and accelerated vaccination plan. Additional funding of 14 billion Kenya shillings from the World Bank will enable the country to procure more vaccines via the African Vaccine Acquisition Task Team, AVATT, and other COVAX facilities. Now, Kenya also expects 13 million doses of the single-dose Johnson & Johnson vaccine, with the first consignment expected in August.
In his State of the Nation address, President Uhuru Kenyatta outlined the new targets in Kenya's revised vaccination deployment plan. From the initial plan, which hoped to vaccinate 10 million Kenyans by June 2022 and over 16 million Kenyans by June 2023, the revised target is to have 10 million Kenyans vaccinated by Christmas and 26 million Kenyans, almost the entire adult population, by the end of 2022.
In fact, by Christmas of this year, we intend to have vaccinated over 10 million adults, according to our experts, and we will have built a capacity to vaccinate 150,000 people every day as of August of 2021.
So far, Tuesday, June 29th, only 1,334,749 doses have been administered, with 1,005,901 being the first dose and 328,848 being the second dose. The population of adults fully vaccinated is 1.26%. But how will this acceleration and increased uptake be achieved? Kenya has ordered 10 million doses of the single-shot Johnson & Johnson vaccine. Having negotiated securing the vaccines at a lower price, Kenya hopes to acquire 13 million doses, with the first consignment expected in August 2021.
And if a vaccine for underage populations is registered by early next year, we intend to vaccinate an extra 4 million young adults by June of 2022. With a vaccinated population of 30 million people, this will allow us to begin the journey for herd immunity.
But financing still remains the encasing ball for all vaccine interventions. The World Bank has approved $130 million, that is 14 billion shillings, additional financing to Kenya for acquisition of COVID-19 vaccines. In a press statement, the bank said the additional financing will enable Kenya to procure more vaccines via the African Vaccine Acquisition Task Team initiative and the COVID-19 Vaccines Global Access Facilities, COVAX. It will also support the deployment of those vaccines by boosting Kenya's cold chain storage capacity. Among interventions would be to establish 25 county vaccine stores, strengthening the capacity of 36 sub-county stores, and equipping 1,177 health facilities with vaccine storage equipment. Keith Hansen, the World Bank Country Director for Kenya, further said, and I quote, "The additional financing will help Kenya in its concerted efforts to contain the rising cases of COVID-19 infections and will help accelerate the deployment of vaccines to the wider population." End of quote. The money will also be used for vaccine safety surveillance, training of healthcare workers, and advocacy and communications activities to encourage COVID-19 vaccine uptake. Treasury had allocated 26 billion shillings for vaccine interventions, and with World Bank's funding totaling 26.5 billion shillings, Kenya's vaccine financing will cost 52.5 billion shillings. Kenya, just like several African countries, also seeks to be self-reliant in production, supply and distribution of human vaccines besides just the COVID-19 vaccine.
We will be building in Kenya a fill and finish plant. The plan being to import the COVID-19 vaccine unpackaged and finalize the logistics of filling and packaging here in Kenya. This will save us on time and will make us a supply hub for the East and Central African region.
Dorcas Wangira, Citizen TV, Nairobi.